News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello, I'm Tom Lavin. Welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you or a loved one has suffered with diabetes, you'll want to watch our show today. Or if you're a healthcare professional watching this on the local ABC affiliate, or if you're watching this online, you'll want to watch our show today if you'd like to learn more about cutting-edge techniques for prevention and intervention with diabetes. We have two excellent guests. On my far right is Dr. Amy Kahn, the medical director at Concentra. Dr. Kahn, thank you so much for being here today.
Thank you, Tom.
And to my immediate right is Peggy Knipp, and Peggy is a registered dietitian. And from these two very experienced guests today, we're going to learn quite a bit about the prevention and intervention with diabetes. And I think, Dr. Kahn, one of the things that our viewers might really be interested in is just, is there help and is there hope for people with diabetes?
Oh, absolutely, Tom. As one of the most common chronic illnesses now faced by many Americans, fortunately, we live in a country where there's a lot of options in terms of treatment and obviously a lot of information and support for living in ways that are going to either manage the diabetes better or prevent it or manage its complications in terms of preventing adverse outcomes.
Well, that is some good news because it is such a debilitating illness affecting the whole person physically, mentally, emotionally. Peggy, from your experience, what can you share with us about this idea of help and hope for people with diabetes?
Well, I would certainly echo what Dr. Kahn said. There is a lot of help and a lot of hope available. And, as you just mentioned, it can be very debilitating. It doesn't have to be. And I think that's really the key, and one of the things that we are going to focus on is, talking really about prevention. You can prevent, even if you've been diagnosed with diabetes, you can prevent some of the horrible complications that are typically associated with it if it's not well controlled.
Could you pick that up, Peggy, and just tell us a little bit about this idea of prevention?
Well, from a nutrition perspective, absolutely, I can't say enough about the importance of eating properly, feeding yourself well. Preventing the disease to begin with is really key. And what we're talking about here is type 2 diabetes, the one that used to be called adult onset diabetes, is the one that has just become so widespread in our country. And I think that's the one that we're really referring to here in terms of prevention. And that means really taking good care of your health before it happens, of course. But once you've been diagnosed with the disease, preventing the horrible complications that may come along really involve lifestyle change. You may need to change the way you're living. Certainly, if you don't have it and you don't want to get it, then keep up the good work. But if you do have it, you really need to change your lifestyle.
So, Amy, it seems like maybe there's two things. One is someone identifying the symptoms of the illness, and then the other thing is the motivation to actually do those things that someone learns that they need to do. Can you tell us a little bit about maybe both of those things?
Oh, absolutely. Tom, it's interesting because most diabetics didn't start out, being diabetic, and it didn't happen overnight. It happened really over a period of time, often years, if not decades, where there's a combination of weight gain, inactivity, poor diet. Many people have a syndrome called metabolic syndrome, which puts individuals at tremendous risk for diabetes. And it's really about making sure that individuals recognize what they do every day, whether it's what they eat or what they do physically, has an impact in their overall risk for developing diabetes. So providing that sort of awareness and then providing people with the ability to successfully make better choices for themselves is what is a key part of preventing diabetes to begin with. And again, Peggy, to your point, it's really about adult onset diabetes, type 2 diabetes, if you will. That seems to be weight-related, associated with a diet that's high in carbohydrates and refined sugars, associated with limited activity, and really is quite preventable. The challenge, as you mentioned, is how do you get people engaged and pay attention to, boy, I have a risk that I can prevent. So to the extent that we can be there to support people in recognizing what choices they have, what better choices they might make. We'd want to do that. And it's not hard to identify someone who might be at risk through screening with measurements such as blood pressure, waist circumference, fasting blood sugar, fasting triglycerides, and the HDL, or healthy cholesterol levels. We can identify those most at risk for diabetes. Clearly, having a family history, having a weight problem, overweight or obesity, puts one at additional risk as well. So at that point, it's really about how do you sell healthy behavior to someone who may be on deck for something much more significant. And it's true that some people will have impaired fasting sugar levels for a period of time, months if not a year or two, before they actually go into the diabetic state, if you will, or can meet the criteria for diabetes. But if you can get their attention and provide them with something more personal to intrinsically kind of motivate them about making some different choices, you can make a huge difference. And that individual can actually divert themselves from that trajectory of disease that they'll otherwise be on.
Mm-hmm. Peggy, could you kind of pick up with that a little bit, maybe about this idea of intrinsic motivation? We have about a minute left in this segment.
Right, and that is a perfect lead-in here to what you're asking, because it really is about changing behavior, as I mentioned before. And yeah, you can know all these facts, but knowing them doesn't mean necessarily what to do about it. Mm-hmm. So, what we've done in our programs is really try to integrate the ACT therapy or ACT training to help people learn how to change that behavior, to get on track. That intrinsic, let me be mindful about my choices. Let me think about what I'm doing. Let me think about what's important in my life in order to change this path I'm on, because I'm headed down the wrong road.
Yes. Well, that is some excellent information. And after this brief break, we're going to return and find out more about our guests and their expertise, find out more about acceptance and commitment therapy and prevention and intervention with diabetes. Hello and welcome back to New Skills for Living. We're talking about diabetes prevention and intervention with Dr. Amy Kahn and dietitian Peggy Knipp. And Peggy, let me ask you, would you please tell us a little bit about this integration of acceptance and commitment therapy with what would be called like patient health information and training and education?
Right, with health education and any chronic disease, weight management, any of those kind of issues. We've really worked hard at integrating the ACT commitment training into our programs, because we feel the importance, the value, again, of helping people to change their behavior. So the idea is to help people really focus on their values. That's really the key to it. And because if you're focused on a number on the scale, or the fact that you have to check your blood, every day, or your medications, you kind of lose the forest for the trees. So the idea is to be mindful about your choices, integrating your value system into making healthful choices and changes.
So can you give us an example, like when you're talking with a patient about values? What are the kind of things that your patients come up with?
What they often say to me is, oh, I can't do this. I've tried so many times before, whether it's weight loss, whether it's taking their medication, whatever it is. I can't do this. I've tried it so many times before. And I try to help them realize that that's just a thought. That's not necessarily the truth. Let's focus on what's your value here. What are you headed for? Well, I want to spend, I want to see my kids graduate from college. I want to share time with my grandkids, those kinds of values. I help them to really focus on what's important in their life, not get so hung up with what they can't do and what's so hard about this. Yeah, it's hard to have diabetes. It's hard to manage your weight. It's hard. Those things are difficult. So the idea of integration here is helping people to live with that discomfort, that difficulty, if you will, and move forward toward their values. You know what, I really want to spend time with my grandkids, so this is important that I check my blood every day, or that I take my medications properly, and so forth.
So that they kind of link a goal or a value that they have, or the way they want their life to be, with these concrete lifestyle behaviors and changes that they need to make?
Right.
Okay.
Right, but I do want to distinguish the difference between goals and values. Goals are very temporary. Values are what your life is about. Yeah, a goal could be, I want to weigh X number of pounds. Well, when you get there, then what? So we have to focus on the values, the bigger picture.
The bigger picture that what someone wants their life to be about.
Exactly.
Okay.
Exactly.
Amy, can you tell us more about that, please?
Sure. I think part of this comes back to sort of where you see yourself going, and what did life happen to you, or did you actually make something happen in your life? And it's really getting to people's sense of passion. What makes them tick? What is valuable to them? What is deep to them and sacred? And so part of this approach is really whether we're dealing with diabetes or pre-diabetes or any other chronic illness or wanting to stop smoking, it's really about tapping into the very essence of who we are, what's important to us. And I think what's very valuable about the ACT incorporation into sort of basic health education is that it's much more personal. Frankly, as a population, we've been, put in a lot of public health interventions that have to do with the environment or have to do with fluoridated water or looked at immunizations. But when we think about behavior change, when we have a choice, it becomes very personal. And first of all, people need to recognize they have a choice. It's not just, maybe they have a thought they can't do it, but if they stop, they really do have a choice. Empowering individuals to recognize that, but then having them make a choice that's most aligned with themselves, kind of including yourself in the conversation, as opposed to ignoring yourself in the process. It's really what that's about.
Well, that was some wonderful information. Of course, one of the key things that we're hearing here is that how important it is in terms of prevention and intervention that it be personal, that it be tied to the vision that we have of our lives and who we want to be. We're going to explore that further after this brief break. Hello and welcome back to New Skills for Living. We're talking about prevention and intervention with diabetes, and I'd like to start off with Dr. Amy Kahn. Can you tell us a little bit more about your perspective about recognizing this illness and preventing this illness, please?
Sure, absolutely, Tom. Awareness is obviously a key part. I mean, we've seen terrific increases in the rate of individuals who are diagnosed with diabetes. I mean, it's really daunting when you look at the map of the United States and you see that the prevalence or the proportion of adults who are diagnosed has more than doubled over the last decade or so. And we recognize that on the clinical side because people are, presenting with diabetes and needing to be treated for the diabetes. But what we haven't done a great job at is reaching out to the public, reaching out to individuals at risk and saying, hey, hello, here's a wake-up call, you're on deck. So with the 8% or so, 24, 25 million people who are currently diabetic, we've got twice as many who will become diabetes if we don't intervene. Now, first of all, awareness is a key part of that. And one of the things that we've done with Total Care in our program is to really reach out to work sites, recognizing that most of us spend more time at our workplace than probably any other one place. And it's an opportunity to, in a fairly organized way, provide messaging and communication to just raise the awareness of why it's important to pay attention to your weight, to your diet, to the level of physical activity. Quite frankly, I don't think people realize a combination of physical activity and a proper diet reduces the onset of diabetes by about 58%, more powerful than any medication. So we know that we've got the secret sauce. We just have to get people aware of what the sauce is and have them start using it.
Peggy, what would you like to add to what Dr. Kahn was saying?
I would really like to stress the importance of the work site wellness, if you will, because we've seen such an impact of the group synergy. When you get people who know each other, work together, see each other every day, often more than their spouse in some situations, there's a real synergy there. And I think that speaks to the accountability of what we're talking about here. Behavior change involves not only what's inside yourself. We know that, and we've talked about that, and the importance of really looking at yourself and your own values and where you're headed. But there's other people going, too, along that road with you, and it may be family, it may be friends, co-workers, or whatever. But the importance of support from others, I think, goes without saying, and that is so valuable in a work environment because everybody's doing it. They just sort of get caught up in the motion of it, and I think that's what's really valuable about the programs that we've developed.
So, Peggy, what are some of the things that you and Dr. Kahn are doing in the workplace?
Well, we developed a program called Fit for Life, which really is addressing those people that we've mentioned that are on deck, so to speak, the people with pre-diabetes, or not even necessarily, the word diabetes in the program, but who need to lose weight, who need to, have had their wake-up call. And it's time to focus on fitness and focus on nutrition and focus on those lifestyle risk factors and making some healthier choices. And another more recent development is the Control for Life program, which really is very focused on people who have been diagnosed with diabetes or who have been diagnosed with pre-diabetes, to help them really live with the changes in managing. It's not a clinical program. I really want to stress that. It's not about the clinical management of, your insulin shots and so forth. It's more about helping people change their behavior dealing with this chronic illness or chronic disease.
Okay. And then, Amy, how do people contact you individually, or do employers invite you into the workplace? Or
excellent question. I think most people know Concentra as the sort of you come to us service, where we have centers across the nation, actually, in 40 states. And it's usually focused at urgent care and injury related to workplace hazards, et cetera. But the other component of our business is really the we come to you, and it's principally involved in our health solutions branch, where we have our total care program. We actually go to the workplace of our clients and provide consultation, assessment of what the needs are, and we'll offer services ranging from a health improvement program, a real worksite wellness with all the components that are integrated and that have been shown to be effective, and then couple that with on-site clinical care where needed.
Okay. Well, that is some good information that we want to follow up with right after this brief break. Hello, and welcome back to New Skills for Living. We appreciated you being with us, and we're in our last segment now. Up on your screen, I believe, is information on my website. If you would like to watch this show again in video, it'll be on the website that's up on your screen in streaming video. And then I also want to talk with you about our guests. Obviously, you've been impressed by how articulate and knowledgeable they are. I have been. But let me share with you a little bit about Dr. Amy Kahn, who directs Concentra's health management program that integrates health promotion, preventive services, and primary care to improve individuals' health while reducing overall cost. Dr. Kahn has extensive experience in population health, disease prevention, and behavioral change, having previously served as a medical director with the CDC, as well as Kaiser Permanente in Northern California. Dr. Kahn holds board certifications in internal medicine, preventive medicine, public health, and addiction medicine, and is a nationally recognized expert in worksite health improvement and integrated health management strategies that improve health and prevent disease. And so we're very grateful that Dr. Kahn has been here and will continue to be here in this last segment with us. And of course, to my immediate right is Peggy Knipp, and Peggy is an independent nutrition consultant. She is a registered dietitian with a master's degree in nutrition and holds certificates in health coaching and adult weight management. She developed the Fit for Life and Control for Life programs for Concentra, which are targeted lifestyle courses that incorporate acceptance and commitment therapy principles into weight management and disease lifestyle management curricula. For the past 6 years, Ms. Knipp has developed and implemented wellness programs for health management agencies in Northern Nevada, as well as maintained her clinical and educational practice of assisting individuals in meeting their personal nutrition goals. And so we have two knowledgeable and accomplished guests with us today. And so, Amy, would you talk with us a little bit more about what is it that you, in this last segment, you would really like to share with our viewers about this topic of disease, diabetes prevention and intervention?
The biggest message I want to say is know your numbers. Know if you're at risk. And you can't look at somebody or you can't look at yourself in the mirror and say, oh, I feel like I might be at risk. It really is about going out, getting measured, getting tested. It's one of the products that we offer on site for many of our employers. These are not, tests that you can do at home. You usually need to have a health professional do the body measurements. There's some blood testing involved. And it really does point up the need for, a more proactive approach, obviously, that's primarily led by that interest on the individual. Sometimes employers will motivate an individual by incenting participation, what have you. But once you do get assessed, it's really about taking action, taking the steps that you need to make a difference in that long-term outcome. I think the key piece about our Concentra Acts for Life program is that we've integrated a approach through acceptance and commitment training and melded that with the traditional health education so people can not only start making changes but successfully sustain those behavioral changes. And that's really the steroid boost, if you will, that ACT gives our health education series, certainly in Control for Life and Fit for Life. And Peggy, I'm sure you have more to share about that.
Yeah, I think the really important part, of course, is knowing your numbers. But then, what do you do with it? Once you know those numbers, then what? Once you've been assessed, and oh my gosh, now I have this. Now what? And so I think that really is important. The next step is really key in doing what's important, taking care of yourself, taking care of your life, and taking care of that journey that you're on. How long do you want to be on that journey? None of us knows how long we're going to be on it. But what do you want it to look like while you're there?
Yeah.
So I think that's really the key.
Yeah. So maybe in this last half minute, Peggy, if someone out there has said, gosh, I've got diabetes, or my family, we're at risk for diabetes, in terms of accessing that internal motivation, just in this half minute, what would you share with them?
Oh boy, that's a big question for 30 seconds. But, I think you really need to be mindful. What do I want to do with this information? I really think it's so important to be introspective and say, why is this important to me? Some people we have to ask 5 times. You want to lose weight. Why? Well, I want to look good in my clothes. Why? Just go into it that way.
Yeah. Well, thank you so much, Dr. Amy Kahn and dietitian Peggy Knipp. Thanks, you guys. Nice information. Thank you so much. And we want to thank you for joining us. Again, you can watch the show online if you want to, and we'll see you next month when we continue to take a look at integrating behavioral health and acceptance and commitment therapy. Thank you very much.